Hello, my name is Jody Scholes, and I am your instructor for the MBLEx review class. And it is my pleasure to be here with you today. Today we're talking about pathology and what exactly is pathology, right? And so we're just going to have a organic conversation about the top 10 pathologies in the United States. In your online learning center, there is a specific class on pathology, and it talks about the 10 most common medications. We're going to switch that a little bit today, and we're going to look at the 10 most common pathologies. You would think that they would line up, right? But not so much. So we'll be doing that. So our class today is in 3 parts. Part number 1 is our test taking strategies. We'll move then into part 2, which is learning, and part 3, which is dissecting questions. All right, you ready? So this week, what I would normally talk about is control what you can control on game day. And you may have heard me talk about game day before. And for me, I've got a game day coming up, which is the publication of my book. That's kind of game day. We've talked about Super Bowl. And this week, we had a lot of success. We had 3 therapists in the last 10 days pass the MBLEx. Woohoo! And we celebrate that. Congrats. It's so exciting. It just fills my heart. However, 2 days ago, we had somebody fail. Yeah. And this particular graduate was pissed, as you may have experienced yourself if you've taken this test. Very frustrating, super annoying, so tricky. And here's what I'm asking you to do. You're already here. Many of you have already taken the test at least once, some twice. Heck, Reva doesn't mind me saying that she ended up passing on her 7th time. Her 7th. Yeah. And so what I'm asking is that if you've had that experience, if you have that experience in the future, that you fail forward, that you take this MBLEx and you fail forward, feel the feelings. Definitely feel frustrated, feel angry, feel sad, look, here's the one thing I don't want you to feel. I want you to identify if you're feeling any shame. It's a big one. Oh, you're supposed to be ready. You're supposed to be smart. Oh, you got family, you got friends, you got classmates, all expecting that you're going to pass this test. And if you have the experience of failing forward, sometimes there is shame. No, absolutely not. Exactly. Frankie shares, I was upset when I failed because it felt like they were saying I wasn't good enough. That is absolutely not the case. I think we can identify with this, right? I think we can understand if maybe you felt it or you know of someone. And here's how I'd like to flip the script on that. That emotion, that strong feeling that you have can be channeled. And I'll talk to you about that in just a moment. If you fail the MBLEx, if you already have, or I'm going to ask you to man up about it and let people know. If somebody asks, don't deflect. Own your experience. Hey, I failed forward. Because here's why. If your best friend took the MBLEx and your best friend failed the MBLEx, what would you say to them? Put it in the chat. I'm going to open our chat window. hopefully close that window. Yeah, there we go. Yeah. So what would you say to your best friend who failed the MBLEx? Would you say something like, hey, it's a hard test. It's okay. Hey, that has nothing. You are an awesome massage therapist. This is just a temporary setback, a temporary delay. Tanya says, I'm sorry. Keep trying. Don't give up. Absolutely. And we heard that this week from Val. If you read her quotes about taking the MBLEx this week, she was sure she had failed. She was like, okay, I'm going to be retaking this. Yeah, Deborah says, I'm sorry, but please try again. Yes, don't give up, fail. Don't give up. Myra Renee says, don't give up. A fail is just one step closer to a pass. Yes, yes, and yes. And I would ask that you take these comments and give them to yourself. I'm going to pass them along to the graduate. Take the time you need to feel what you're feeling, and then let's look at what steps we can take to do better. Exactly. When we have a dialogue like this, especially the dialogue in our head, this is what's important. Because when we can flip the shame switch, and look, I'm not saying I'm impervious to it. I feel it too. But I catch myself and I'll be like, okay, why am I feeling so down? Why am I feeling embarrassed and I get to own it. We get to own it. Hell yeah, you failed it once, failed it twice, failed it 3 times. Who cares? Not everyone's a great test taker. That's okay. Sometimes it takes you a few practice tests to get ready. Yeah. When we own it, we make it our own. We say, yeah, I had that experience. Really sucked. Yeah. Then in that instant, you are channeling all of that negativity and flipping the switch to turn it into positivity. You are channeling the strength of that emotion into your determination to pass. Hey, sometimes you got to get pissed. And it really, especially if you're a good test taker. In fact, I had a graduate quit about, oh golly, it would have been earlier this year, about 6 months ago. He quit the program. He quit this program. He said he wanted to take a break. That's, permission, of course, there's no contracts here. He had been a straight A student his entire life. It was very difficult for him to face the fact that he had failed this test. He thought he had it on lockdown. Don't be that guy that just throws your hands up and says, I'm not doing this anymore. Because I also have graduates who've come back after 10 years out of school and said, you know what? This is in my heart. This is in my heart to do. Look, even if it's just for friends and family, even if you never charge, don't get me started on that topic. This is in your heart to do. And therefore, we come together to learn, but also to support. So, would you humor me? Put your hands out and just hold them at that computer. And this is for our graduate, and we'll name her. I don't think she minds. Melissa. We had a Melissa who passed, and we had a Melissa who didn't. And for all of those other graduates of massage school who have failed forward and didn't feel supported, we are sending you love and light support, and just know that this is a safe place to land, because I see you for who you really are. I see you as a licensed massage therapist, even and especially when you can't see it for yourself. And I'll close with this thought. I'm trying to remember who said it. I believe it's Khalil Gibran, the poet. And he said that a true friend sings the song of your heart when you've forgotten the words. And we are here to see you for who you really are, a licensed massage therapist. All right, let's move into our learning with one more comment here. I know someone, Vanessa says, I know someone who graduated at the top of the class. She feels she's a good test taker, but since she failed several times, she doesn't want to take it anymore. I know. It's a different path for all of us. You know, nobody painted the picture of failing the MBLEx 3 or 4 times before you got licensed, did they? No. This test is a beast. As Val put it, it's a monster. She expected it to be a monster, and she says it didn't disappoint. Love it. Maria says, that's me. I graduated in 2012, and I've taken it 3 times. That's right. It's a freaking badge. I've taken it. It's a badge of honor that you are still here. It shows your dedication to the profession, your dedication to those clients who will love, appreciate, and who need you. So yes, remember the words of Khalil Gibran. A true friend sings the song of your heart when you've forgotten the words. So we're here to hold the space for you until you graduate. Until you pass. All right. Let's move into part 2 of our session together today. And that is common pathologies for massage therapists. Typically, I'd have a fancy PowerPoint for you, but I wanted you to be able to do this work on your own. This is our kind of bonus class in this session today, in our 8-week sessions. So fair warning, next week in November, we get a new Zoom link. So if you've saved this one, you're going to need to update it. All right. So very simply, what I did and what I will show you . These are our most common pathologies in the United States. We're going to work through them one by one today, and we're going to identify exactly what they are, what medicine they take to treat this pathology, and the session adaptations that you may need to make in order to treat these conditions. You're gonna need to know most of these. Let's start with a fan favorite, diabetes. We'll come back to this in just a moment. I want to watch the comments in the chat. So let's go, since we're having a discussion, to our gallery view. So diabetes. I'm going to throw this back out to you guys. Diabetes. What is the organ? Kind of a wild question, huh? What organ is associated with diabetes? What organ is not functioning? First of all, I'll tell you what. Tell me, what is diabetes? What is the condition? Put it right there in the chat. I'm going to start us off with diabetes. So I will say diabetes. Sometimes people find out they have it when they're born, and sometimes they find out they have it later in life. There's two types of diabetes, type 1 and type 2. It's like thing 1 and thing 2. Type 1 and type 2. So diabetes has to do with blood sugar, right? Has to do with blood sugar. So blood sugar, diabetes and blood sugar. Yes, high blood sugar. Yes. So diabetes is a problem because there's uncontrolled levels of sugar in the blood. Uncontrolled levels of sugar in the blood. The hormone, the chemical that controls the sugar in our blood and that some diabetics have to take, yeah, there we go. Good. Vanessa says insulin. Yes. So diabetics are sometimes on insulin. We actually have 3 different categories of diabetes. We know type 1 and type 2, but there's also a condition called pre-diabetic. And so when they're pre-diabetic, that means that lifestyle choices are going to determine which direction they go. Let's first talk about what we see most commonly, and that is type 2 diabetes. This is also called acquired diabetes, meaning something we've done, we've acquired diabetes. We've acquired high blood sugar or low insulin levels, right? 2 different ways to say that. Low insulin levels, high sugar levels, high glucose levels would be another way to say that. And I'm talking about the MBLEx. Other ways they might indicate that your client is experiencing symptoms of diabetes. So type 2 is acquired. Lifestyle choices, eating lots of sugar, eating artificial sweeteners, consuming artificial sweeteners, lack of exercise, gaining weight. Lots of different lifestyle choices can lead to someone being pre-diabetic or type 2 diabetes. And that means they may need an insulin shot. They may need an insulin shot. They may need to have an insulin pump. But they need to monitor, and there's different ways to monitor their sugar levels. But they need to monitor their sugar levels and take insulin that's been produced, artificial insulin, right? So something that's not produced by their body. Bonus point. What organ produces insulin? Tell me. You will need to know this. I know, kind of stinks, but yes. We need to have a general understanding of these pathologies. I'm going to give you a minute to, someone wants to put that in the chat. Yes, Myronay says pancreas. That's right. The pancreas produces insulin. It also produces digestive enzymes, excuse me. Thank you, Lana. Yes, the pancreas. So the pancreas produces insulin and it produces digestive enzymes. Its big role is to help with digestion, but we know it best for insulin production. Now, this will not be on the MBLEx, but I want to share it with you. Artificial sweeteners. Insulin does not digest artificial sweeteners, and that's a problem. Because the way our pancreas works is as soon as we taste something sweet, it sends a message. Our brain sends a message to the pancreas, says, kick in, brother. Time to digest some sugar. We're getting something sweet. Ooh, they're enjoying it. Maybe it's cake, maybe it's candy, but maybe it's diet soda. Or maybe it's something made with artificial sweeteners to give it 0 calories. Don't be fooled. Don't be fooled. Diet is not always healthy. Losing weight is healthy, but diet is not always healthy. Because when we consume artificial sweeteners, and I'm just going to pick on Diet Coke. I'm sorry if you love Diet Coke, don't be, go for it. But as I pull my water out, I'm just going to pick on Diet Coke because it's easy to pick on them. Diet Coke has a lot of artificial sweeteners. And when our body thinks that we're getting sugar, and then we don't get it, the pancreas sends out all this insulin. And then it doesn't have anything to digest. Artificial sweeteners have to be digested in a different way. They have to be treated in a different way. So the pancreas starts to get wise to this. And the pancreas says, screw it. Every time I send insulin, there's none there. There's no sugar there. And so it stops making as much insulin. It stops throwing it out there. Because, it's like crying wolf, right? There's no wolf. And then when there's really a wolf, nobody comes to help. Do you remember that nursery rhyme? Kind of. But this is like faking out the pancreas. And so the pancreas decides, oh, I'm going to adapt. I'm not going to produce as much insulin. That'll save me some energy. And then what happens is that the client becomes pre-diabetic. Their body's not processing sugar. They've got these uncontrolled highs and lows in their blood sugar, all because they have faked out their body. So this whole category I'm talking about right now is type 2 diabetes and pre-diabetic conditions. So acquired diabetes, okay? So these are lifestyle choices, and it's not just about sugar. Sometimes, people just gain weight. I mean, look, we had COVID, right? I mean, there should be like the COVID-10. But these are lifestyle choices here's the good news. Here is the brilliant news about a body. By making different lifestyle choices, we can support our pancreas, we can support our body, we can support our health, and regain the pancreas's ability to produce normal amounts of insulin, especially in the pre-diabetic condition. Great news, right? They didn't jump off a cliff and they're gone. No, not at all. They can bring it back. Yeah. And it's tiny little baby steps. Tiny, tiny, tiny. You don't have to give up all soda. Just maybe try regular soda. You don't have to give up all sweets. Maybe just have them a couple days a week with intention. So anyhow, I digress. I'm going to come back to our MBLEx topic because this is type 2 diabetes, but there's another type of diabetes, and that is type 1. Type 1 diabetes is congenital. They're born with it. There's something that's not working in the pancreas. They're not producing enough insulin, and they need regular insulin introduced into their system on very specific time frames. So sometimes you'll see an insulin pump in the back of the arm. In fact, I will show you an insulin pump. So you can see the one you're seeing on the screen. Just change our view here for a moment. So the one you're seeing on the screen is the one that actually is a pump that hooks onto a pant or a belt and is in the abdomen. And then here's the other one. This is on the arm, and it's monitored wirelessly. This is typically, these types of insulin pumps, if you see them on a client, just avoid the area. No big deal. So your session adaptation would be to avoid the area. So that's a fancy way of saying, what would you change in your session? What would you adapt in your session? What session adaptation would you make for an insulin pump? You would simply avoid the area, right? Yeah. And type 1 diabetes is congenital. They're not getting over it. This is just something they're living with. Um, and so, um, so they do make lifestyle choices to support their diabetes, but they learn to live with it. Yeah, they're really good at monitoring their blood sugar, their glucose levels. Excellent. So in review, we have pre-diabetic, type 2 diabetes, and type 1 diabetes that you may be asked about on the MBLEx. Diabetes has to do with the production of insulin. It's irregular blood sugar. The session adaptation you would make is simply to avoid the area if there's a pump. The other session adaptation that you may make is to have actually some crackers or some ginger ale around for your client who you know is diabetic. If they get off the table and they're feeling a little lightheaded, they may need some food. They may need to take something in, because massage therapy, one of the benefits of massage is it improves absorption. We think of that as digestion, right? It aids in digestion. But also, if a person is on medication like insulin, it may absorb into it may be absorbed by their body more quickly, more efficiently. And so we want to just be aware if our diabetic client is feeling lightheaded at all. That would be a question for either during the session or after the session. Yes, and Vanessa says she remembers that type 1 comes first at birth and type 2 comes later, lifestyle. Great way to remember that. Type 1 at birth, number 1 is before number 2, number 2, lifestyle. So good. So again, you'll be maybe asked about the pathology of diabetes. What is it? What organs are involved? What's the condition? Or you may be asked about a session adaptation for someone with diabetes. All right. I think you'll find this helpful. Let's go ahead to our next pathology. There we go. And we'll leave this screen up for a bit. Let's open this up. Good. Okay. So the next, probably most common pathology would be heart disease. And so heart disease is also, heart disease is caused by high blood pressure. Hypertension is another word for high blood pressure. So what are the different types of conditions that you may see in your treatment room? All right. We're looking at cholesterol levels when we look at heart disease. So heart disease is the progression. Sometimes it's a clogged artery. Sometimes it's clogged veins. Sometimes people have had bypass surgery. Sometimes people have had open heart surgery. And so a pathology, heart disease, where you look specifically at hypertension as far as massage therapists, that's what we're going to be treating. The high blood pressure, the hypertension. So with high blood pressure, clients have a choice to either take medication or not take medication. High blood pressure is caused by chronic stress, lifestyle choices, high cholesterol diet, many different causes of heart disease. Be very careful on the MBLEx if they're asking you a question about high blood pressure. Truly dissect the question. Understand if they're asking you about the pathology or if they're asking you about session adaptation. Very often on the MBLEx, you will see 4 right answers. I shouldn't say very often. There have been times, often, that there are 4 correct answers. Your job is to find the best answer. The only way you're going to be able to do that is to fully understand the question. I recommend you read the question at least twice. Now, I already hear it. I hear graduates tell me all the time, but Jody, I'm going to run out of time. We do have to be mindful of the time. That test in many, many, many testing centers, I would say in almost every testing center, the timer is actually visible. And so that timer is ticking down. Make sure you know whether it's ticking up or ticking down. We cannot ignore the time. But do the math. Do the math with me. There's 100 questions on the MBLEx, and you have 2 hours. So that's 120 minutes. My testing experience, it took about 8 to 10 minutes to get through all the screens and promise that I wasn't going to be recording it, promise I wasn't cheating, promise that I wasn't being human trafficked. So it took about 10 minutes to actually get the first question. But let's do the math. So 2 hours is 120 minutes. Say it takes you 10 minutes to get through those first screens. That's 110 minutes. You've got at least a minute for every question. A minute is a long time. If I was silent for a minute right now, you'd be like, what's up? A minute is a plenty of time. Some questions will take you much less time. Some questions you're just going to be like, okay, when was the War of 1812? 1812. That's not going to be on your MBLEx. We don't have any massage history on the MBLEx. That was just a random trivia question. But some questions are going to be very straightforward. You know, your client is having a heart attack. What do? You call 911. If you get that question on the MBLEx, you call 911. Even if in practice you would monitor the situation, doesn't matter. On the MBLEx, you call 911. I have a comment here that says you should have plenty of time. Frankie says you have plenty of time. I had 45 minutes left. Wish I would have slowed down. And Vanessa says, yeah, they have a survey now before you take it, which is weird. Yeah, so excellent information though, right? There's a survey? Yeah, and that counts as part of your time. At least it did for me. And yes, as you're taking your practice exams, please slow down. And my practice exams, if you're taking practice exams with me, you have 4 hours. 4 hours. So you can take your time. Now, remember, we approach these practice exams in one of 2 ways. Either we're simulating the MBLEx, which you got to do. This part of the practice exam, you can't avoid. The other way to take a practice exam, you never have to do that. But this, to simulate the MBLEx, to be successful, you must. You must sit down, take the test, start to finish, finish in under 2 hours, score a 70 or better. You do that with me 3 times, and we're good. I will give you the blessing to go forward and take the MBLEx. But some of you want to do meaningful homework and use the practice exams to supplement your learning. I fully endorse that. If you're taking the practice exam and you get stumped on a question and you want to open a new window and Google see if you can figure out the answer, go for it. If you score 96 on that practice exam, I know you're Googling shit. I know you're looking it up. And that's okay. That's absolutely okay because you're using the practice exam to learn. Don't be fooled. That is not the same as passing it. You must pass it without assistance within 2 hours, scoring a 70 or better. And then, good possibility, you'll be ready for the MBLEx itself. But coming back to our topic of high blood pressure, heart disease, hypertension, read the question carefully. Understand if it's looking at the pathology or it's looking at the session adaptation. Cholesterol clogs arteries, causes blockages, causes heart attack, causes heart disease. I'm simplifying. Session adaptation. Our concern with high blood pressure is whether or not it's controlled. Controlled or uncontrolled. Controlled with medication, we proceed as normal, monitoring the client for dizziness, clamminess, racing heart, the other signs of uncontrolled, those signs of uncontrolled high blood pressure. If the client is not on medication, but is having symptoms of hypertension, aka high blood pressure, cold clamminess, racing heartbeat, shortness of breath, all the signs of a heart attack, dizziness, nausea, but is undiagnosed, we need to monitor that situation carefully. If we know, here's the MBLEx point of view, if that client knows that they have uncontrolled high blood pressure, we cannot work on them. And when I tutor, I have graduates ask, wait a minute, Jody, massage lowers blood pressure. So why would it be a contraindication to work with someone with uncontrolled high blood pressure? Because it's not controlled, we don't know what's causing it. And therefore, because massage affects the blood pressure, makes it go down, it could send it too far down. And there could be a yo-yo effect, creating more instability in the blood pressure. In that case, because it's uncontrolled, we cannot work with the client. We risk making the condition worse. That is what's called a general contraindication. So if we could possibly make the condition worse, that is when we have to, unfortunately, refuse to do the session. Reschedule, apologize, be polite. But if you have the possibility of making that person worse, can you proceed? No. Also, for the point of the MBLEx, if you get a question and you could potentially make that condition worse by proceeding with the massage, that would be considered a general contraindication. Let me give you an example that's not just black or white. Poison ivy. Poison ivy. It's a skin condition. It's temporary. In most cases, we can avoid the area. But if you get a question about poison ivy on the MBLEx, remember, we need to be very conservative. Poison ivy is systemic. It can jump from here to here, down to a leg. Sometimes people are patchy. And so for the purposes of the MBLEx, we have to wait until all of the red bumps are gone. We have to wait until the end of the poison ivy cycle so that we don't make it worse. Highly unlikely that we would make it worse, but there's a possibility, and therefore being the most conservative when answering a question like that on the MBLEx. Excellent, good. And I see one of our grads, Maria, says, if I get anxiety when taking a test, I get anxiety when I take tests. You can go to your primary doctor and get a letter stating that you get anxiety while test taking, and they may give you an extra hour. Absolutely. Absolutely. And there have been people who have done this. And so you can go to your doctor. You can say, look, I get anxiety when I take a test. Could you write me a note that says I qualify for longer testing, for more time? Could be an extra hour, extra 2 hours. That is a special consideration. There are other special considerations, and you would need to talk to the Federation about how to qualify. There is one other special consideration I'd like to mention, and that is having the test read to you. But typically you have to be legally blind. I don't know if they're making any exceptions to that right now, but just so you know, there are test taking, I'm forgetting the word, sorry, but it sounds like precautions. Let me think for a second. We'll just call it exceptions. And so they're difficult to qualify for, but you can see if you can make that work. If you feel like you need more time, give it a try. All right, let's look at one more pathology. Excellent. Oh, where is, let's see. Then, let's talk about cancer. Misunderstood, and one that you most certainly will see. Well, I can't say, I don't know what questions will be on the MBLEx, but cancer is something you will need to know about and need to have confidence as a licensed massage therapist when treating clients who are currently in treatment for cancer, who are cancer-free, who have finished their treatments but are in their first year after cancer, and then people who are 5 years or longer. And so let's talk about cancer. The cancer comes in different areas. It can be brain, lung, stomach. Wow. So there's all sorts of different organs that can get, prostate is another one, men. Only men get prostate cancer. Only women get uterine cancer or cancer of the reproductive organs. All sorts of different ways to treat cancer. There's an old wives' tale, and yes, Deborah says bone cancer, yes. Brain cancer, skin cancer, yes. Ooh, let's go there next. We have time. So with cancer of the organs, not skin cancer, but cancer of the organs. There's an old wives' tale, there's an old false belief that getting a massage could spread the cancer. That is 100% inaccurate. That is false. Massage does not spread the cancer. Massage boosts the immune system. We do have, so we talk about the pathology. What is cancer? Cancer is a disease that eats away at an organ, including skin. It does eat away at the organ. That is the pathology. What is the session adaptation? Well, first of all, is it safe? Yes, it is safe and recommended to work with a client who's going through chemo, radiation, or both. Why? Why is it recommended? Well, number one, it helps with the immune system function better. It helps that client's body fight the cancer along with the medicine. It also helps calm the nervous system. It also helps with the fear, the anxiety, the stress of going through cancer treatments. Session adaptations. So we've got the pathology, we've got the treatment, and we've got the session adaptations. Well, how are we going to change our session for someone who's going through cancer treatments? The major session adaptation, this is the consideration. We must wait 72 hours after any treatment. We must wait 72 hours. Your client may say, oh, I want to come the next day. We still have a best practices. Our best practices say that we must wait 72 hours to allow that medicine to work through your client's system. We don't know their metabolic rate or how quickly or slowly this medicine is going to move through their system. The medicine needs to do its job, which is kill the cancer, weaken the disease. If your client is to come in for a massage sooner, say they came in the same day, can you imagine the concentration of that medicine that would dump into their system? That the body would the body's trying to clean out the medicine, right? They say if the medicine doesn't kill you, right? That the medicine is like sometimes even almost as harsh as the disease, but the medicine has to go in to kill the disease. This is traditional medicine. This is why doctors remove tumors from brains, from breast, from bellies. So a question has come up, what if a client doesn't tell us they have cancer? Some people are not as open with it. This is why we have to do a health intake sheet with everybody. Yeah, with everybody. And we have to revisit their health intake sheet and ask, have there been any changes in your condition? So if they don't disclose, then that's not on us. But it is on us to ask if there's been any changes in their health condition. I'm seeing a client tomorrow who, the last time I saw him, he has had a major heart attack, heart incident. Yeah. And so there's been a big change in his health history. And so I'll be watching for session adaptations to that. I happen to know about it, but tomorrow, since I haven't seen him in 3 months or more, I would have asked, what are the changes? Have there been any changes in your health history? Any major events? Any diagnoses, operations, major illnesses? That's on us to do. All right. So cancer, session adaptation, 72 hours wait. We also need to ask every client, as a reminder, every time, have there been any major changes to your health history? And they're like, no. Okay, so no operations, no diagnoses, no major illnesses. No. Okay, good. Sometimes people forget they had COVID. That actually counts. Now, they may not tell you. COVID, post-recovery, after they've recovered, is not a contraindication. They're not contagious. There's no more signs or symptoms, so they don't need to tell you. However, my health intake sheet says, have you had COVID? Do you think you might have COVID? Now, since COVID got so much publicity, and rightfully so, a great reason to understand why. COVID was a viral infection. It is a viral infection, which means it's a virus. It's viral. That means that antibiotics and drugs aren't treating it. When we have a bacterial infection, penicillin and other drugs have been designed to treat bacterial infections. Viral infections, we just have to let it run its course. And if someone is positive for COVID and receives a massage, they're going to feel much worse. Their body is going to be more efficient at eliminating that virus. And so their symptoms are going to increase, are going to peak. This also happens with influenza, with the flu. If someone thinks they've got a touch of the flu and they come in and get a massage, maybe they don't tell you. They just got the sniffy nose. They've got, maybe they're a little cool or clammy. Maybe they've got a fever, but they're not aware yet that they have the flu. What's going to happen to that client? Be prepared. They may call you and say, I feel terrible. I feel even worse than I did before the massage. I feel like I have the flu. Yes, that is the body's wonderful way of eliminating waste materials. Waste materials include your immune system cleaning out that bacterial infection, cleaning out that viral infection. Our body is going to be stronger in the fight. Therefore, more signs and symptoms, whether it be COVID or the flu. So those are precautions as to why we don't do the massage when there is a systemic infection. It could make it worse. Not necessarily like more severe, but they'll experience their symptoms in more intensely. But the other reason we don't treat someone with a systemic infection, fever, the flu, is because you could get it. Yes. All right. I'm going to address some of the questions in the chat. Hold on just a moment. As far as one of the questions is, do you know if they've added any questions about COVID in the test? So they address COVID in the test simply by talking about sanitary hygiene. So sanitary hygiene practices. And so we must know our best practices. And this is in the guidelines to a professional practice. It's under that category, under that umbrella. And so sanitary hygiene, changing the sheets, changing the headrest cover, wiping down the table, wiping down the headrest cover, wiping down the bolster, wiping down the doorknobs. If you go to work for a franchise, you'll be walked through the sanitary hygiene protocols. Did you get that in school? When you worked with clinic, depending on when you went to school, there may have been less attention given to emphasizing sanitary hygiene. You will need to know sanitary hand washing. Start practicing it right now. Sanitary hand washing, Bonus points in the chat. How many seconds do you wash your hands? 60, 30, 20, 10. How many seconds? Yes. Maria, yes. Vanessa, yes. Tanya, yes. Myra Renee, yes. Pumla, yes. So 20 seconds. So soap and water, 20 seconds. One version of the Old MacDonald or two versions of Happy Birthday, if you want to just count with a song. So 20 seconds sanitary hair, that has come up a lot on the test. And please, 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 hand washing is absolutely the best way, absolutely the best way to keep yourself healthy. Honestly, because we touch our eyes, we move our hair, we stick our finger in our ear, and all of this stuff can be on our hands. Please, right away, after you go to the bathroom, before handling food, just in, did I say after going to the bathroom? Yeah. Before handling food, just make it your regular routine. Some of you pee a lot. It may take you longer to wash your hands than it does to pee. Doesn't matter. 20 seconds makes sure that you're not taking anything from the outside and inadvertently putting it in. All right, we're going to do one more pathology, and then we'll wrap it up. I'm still here, just struggling to open my screen. There we go. All right. We've talked about diabetes. We've talked about heart disease. We've talked about cancer. We've talked about influenza. Let's pick mental health. We don't have as many people today showing up with HIV. So let's talk about mental health. There's a whole segment of a lesson that we talk about boundaries, and I would encourage you to look for the tags that say boundaries, because we've got two sides of a mental health question for the MBLEx. The two sides are you and your client. Let's talk about the client first. In the sense of boundaries. Probably the most common question on mental health on the MBLEx would be about boundaries and knowing the names of boundaries. Those you'll want to commit to memory. Permeable, semi-permeable. These are words that make sense in English. You just want to make sure you're reading that question carefully. So, boundaries. If a client is to violate a boundary for the therapist, let's start with that scenario. So if a client is to cross a boundary, what would be considered crossing a boundary? Is asking about your personal life crossing a boundary? So do you live around here? You married? Got kids? Yeah, it is. It is crossing a boundary. Now, it is not the type of boundary crossing where you have to end the session. You simply redirect the question to them. And that is one of your most powerful tools in the session. We're not here to talk about me. We're here to talk about you. Where did you grow up? Your clients, yes, Myra says inappropriate behaviors, conversations. It can be a gateway to an inappropriate conversation. Oh, you live right here in town. We should grab dinner sometime. Boundary crossing, boundary violation. Boundary crossings you can come back from. Boundary violations, no. For the purposes of the MBLEx, even a touch of the hand during the session could be considered a boundary violation. So boundary crossing, boundary violation. One is less severe. The boundary crossing is less severe and can be recovered from. Hey, baby, baby. How about you? And look, when you use a health intake form, when you dress professionally, when you have established hours, the clients looking for sex or looking for a sexual massage are scared away for the most part. By you establishing a professional environment with your clothing, with your health intake sheet, with your environment, with your hours, establishing that professional environment, even people who are on your table who thought they might make a sexual comment will understand that's no place to do that. But it's up to you to create the professional environment. Now, are there predators out there? Absolutely. You know, some of the worst? Men on men. Yeah, male clients hitting on male therapists. They're shameless. You establish a professional environment and they still sometimes will make a comment, will go fishing. Fishing comments could be considered boundary crossing or violation depending on the scenario. For the purposes of the MBLEx, you will use the 7-step intervention model. You will take your hands off the client, ask a clarifying question, and decide whether or not to proceed with the session. Hands come off the client, you ask a clarifying question, and then you make the decision as to whether or not the session will continue. The client will pay in full, and you will document the situation. If you need more information about the 7-step intervention model, I'll put the name of it here. It's in the chat. You can read through it. I also do lectures on that. But let's come back to mental health, boundary crossings, boundary violations. Be very clear with what is good and what is not good. You neither a borrower nor a lender be, meaning no borrowing from your clients, no lending to your clients, money. That is not in the best practices. So I'm looking at the time and I'm going to make that our last topic for today. And considering the time, we also are going to not dissect questions today. We've been through a number of questions in the content of the material, and I wanted this to flow a little bit more organically today. So as we wind up, I'll let you know that again that my name is Jody Scholes. I am your instructor for the MBLEx review course. I teach here every Thursday from noon to 1 Eastern Standard Time.